Jim Cowen. Jim still here?
Right here.
Can't really see behind me.
Good afternoon. Thank you for giving me this opportunity. My background is I'm an internist, and my background is in health insurance and particularly in the analysis of claims data and program redesign for payers and for providers. And I want to make two comments. The first is that I think looking at the charge of the Commission, the goal is to improve appropriate access to healthcare, and it doesn't really mention costs. And I think it's important to recognize that prevention is actually really cheaper than cure. And there's a couple of reasons for that. One is that with prevention, you may have a small number of people that generate very high costs, but you may have a very large population of people who are at risk for that condition but actually don't get it. And the cost of treating that large number of individuals sometimes, often in fact, outweighs the savings generated from it. The second reason is time value of money, that you pay for prevention today, but the cost savings from cure that come in the future and discounted, and of course it's less than it costs in the future. So, I mean, my observation is that the focus of this discussion should be on quality of care and access to care, and that the cost issue is only a kind of a tool to kind of figure out what you should be doing, but to separate those things, prevention and quality, as opposed to cost, might be helpful and make your work easier. And the second observation I have is that it seems to me that what's really needed here to get to improve access is to understand who are the populations of patients that don't actually have access right now. And that's a different thing from who are the populations of patients that are generating a lot of costs down the road. So who are those people? And they may be grouped geographically because there's no services where they live. They may be grouped by payer. They could be grouped by gender, by age, or by clinical condition. And so that analytic pathway is something that might be worth considering as to how do you get from your claims database to a clear picture of who's actually having access problems, because that would tell you who to target with legislation, whatever is the best tool for improving access to those people and would get you to where you want to go. Thank you very much.
Any questions? Thank you.